Hi, I'm Crystal from Marymount Labs. Here at Marymount Labs, we are dedicated to scaling patient engagement in primary care. And so today we'll be sharing about ChatIRIS, a smart health coach designed to encourage Singaporeans to take preventive health measures like vaccinations and cancer screenings. In Singapore, preventive healthcare is not common practice. Less than 1 in 4 get annual vaccinations. Only one third of eligible adults go for cancer screenings, and more than half of chronic disease patients struggle to manage their blood pressure and glucose levels. The challenge is convincing Singaporeans to adopt preventive healthcare measures. Many avoid screenings and vaccinations due to gaps in knowledge, concerns about side effects, high costs, and inconvenience. While clinics have the option to call up patients one by one to book for screenings, that will be an inefficient and unscalable solution. On the other hand, chatbots can offer a more scalable and broad reaching alternative. Although most existing chatbots can only provide unempathetic static responses that don't adequately address users' concerns. So, how can we create a chatbot to encourage the adoption of preventive healthcare measures? With ChatIRIS, we seek to achieve this by demystifying the procedures and refining our model to align with doctors' recommendations. To demystify preventive healthcare measures, our team leveraged the health belief model in our chatbot to identify and address the psychological barriers by inferring verbal cues when conversing with the user. As such, our chatbot is belief aware as it identifies cues about a person's beliefs and adjusts its response accordingly. Adaptive, it evaluates and adjusts persuasion strategies in real time. Contextualized, its responses are tailored to the Singapore healthcare system. Looking at a high level overview of the ChatIRIS architecture, each user response goes through the health belief policy model, which evaluates the user's health beliefs based on 14 aspects inferred from verbal cues. These beliefs are then grouped into three dimensions, namely the perceived benefits, vulnerability, and barriers of the preventive healthcare measure. At the same time, the user's response passes through a retrieval augmented generation RAG pipeline, which retrieves the relevant information from a curated knowledge base to contextualize the chatbot's response to the Singapore healthcare system. Finally, using the chat history, the belief scores from the scoring agent, and the retrieved context from the RAG pipeline, the conversation model will be able to generate an informed and persuasive response for the user. This process continues until the user agrees to be screened or the chatbot detects significant opposition. Now, we can see this in action using InterSystems Iris platform. The chatbot starts with an initial prompt about colorectal cancer screening and gathers basic health details from the user. In the chat process, the user's input will be evaluated by the scoring agent using the health belief policy model and return the user's belief scores. Here in the RAG pipeline, the system will perform a vector search from the IRIS vector store to retrieve the relevant information which will be used in forming the contextualized response. Finally, in chat operation, the conversation model uses the gathered intelligence to generate a persuasive response for the user. Let's see a quick demo of the chatbot in the next section. Moving forward, we plan to work with clinics to deploy ChatIRIS in a closed setting to refine its effectiveness and address challenges like data privacy. In the long run, the data gathered by ChatIRIS will be able to provide insights on the user sentiment towards preventive healthcare measures. This will allow us to refine our models to be more convincing and optimize the effectiveness of our preventive health campaign. That's a wrap on the ChatIRIS Health Coach. For more information, visit us at marymount.labs.com.